What you need to know about mental health and substance abuse disorders, Orange County Drug and Alcohol Rehab Center, Crescent Moon Recovery LLC. An individual's mental health refers to their psychological, spiritual, and emotional well-being. What is substance use disorder? Substance use disorder, SUD, is a mental health disorder that affects a person's mind, behavior, relationships, and livelihood. 19.7 million Americans over the age of 12 battle substance abuse disorder. About 38% of those adults battled illicit drug use disorder. Is substance use disorder a mental health issue? What may have begun as experimentation or recreational substance use can quickly become an addiction as drugs and alcohol cause significant changes to the chemical balances in the brain. Common co-occurring disorders. While mental health disorders are a risk factor for developing substance use disorders, the opposite is also true. Many people may begin using drugs or alcohol to self-medicate the symptoms of a mental health disorder, which can lead to substance use disorder and worsen any co-occurring mental health disorders. From the NSTU report above, about 43% of people suffering from substance use disorders in America also suffer from mental health disorders. When mental health disorders occur alongside substance use disorders, they are referred to as co-occurring disorders, also known as dual diagnosis or comorbidity. Treatments and therapies offered. When an individual tries to self-medicate using drugs or alcohol, they are attempting to manage the symptoms of their mental health disorder, causing them significant distress. Individuals attempting to manage their mental health symptoms with drugs or alcohol could benefit from the whole person approach to recovery that Crescent Moon Recovery provides. Treatment programs at Crescent Moon Recovery. Intensive Outpatient Programs, IOP. An IOP is designed to provide participants with the same treatment therapies and activities as a PHP, but it gives them the ability to stay at home or in Crescent Moon Recovery's sober living homes. Integrated dual diagnosis treatment involves an initial assessment to evaluate participants and determine the severity of a substance use disorder and any co-occurring disorders. Within integrated dual diagnosis treatment lies many different therapeutic approaches. The open door policy at Crescent Moon Recovery. Our overall goal is to incorporate evidence-based treatments and therapies with holistic activities to address all areas of substance use disorder and co-occurring disorders. Additional services for substance abuse and mental disorders. While the treatment of SUD and co-occurring mental health disorders through intensive therapy and peer support is a priority at Crescent Moon Recovery, many other services are proven to be beneficial during the recovery process as well. Aftercare can positively influence the continued sobriety by assisting participants during the transition from completing treatment and returning to the real world. Case management is incredibly beneficial to participants in addiction treatment as it ensures that they receive the help they need to address their unique challenges in recovery. Crescent Moon Recovery can help. At Crescent Moon Recovery, we understand that there is no one-size-fits-all approach to recovery from SUD and mental health disorders. Many participants see the benefit in working with our medical professionals and case managers in developing a treatment plan that will work to address their particular needs and accomplish their goals for recovery. While our staff makes sure to offer a warm, welcoming environment for treatment, we also hold our participants accountable and offer the structure they need to develop the knowledge and skills they need for a lasting recovery.